I am Dr. Zarina Hassan speaking to you from Islamabad in view of the Glaucoma Week. I am a graduate of Khyber Medical College, 1997. I went on to specialize in medical virology. I've had a career which was focused on research, basically. I have worked at the Aga Khan University. I have been associated with the WHO, and my last assignment was at the National Agricultural Research Council, NARC, Islamabad, as a zoonotic surveillance officer, which was part of a project funded by CDC Atlanta. We worked on brucellosis and influenza. Soon after, I lost sight in both eyes. The story I'm going to share with you, I hope, will benefit patients and doctors alike. I have been a high myope since the age of 12. In 2010, I was diagnosed with juvenile open-angle glaucoma. It was an incidental diagnosis because one fine day when I covered my right eye, I discovered to my horror I could not see anything through my left eye despite my -14 diopter spectacle lens that I was wearing. I rushed to the eye clinic and I was told my IOP, my intraocular pressure measured 50 as opposed to the 15, that's considered the higher end of normal in most cases. Why was I not detected all those years ago? Given the severity of the glaucoma and its aggressive, progressive nature, I must have developed signs and symptoms of glaucoma when I myself was a medical student still, so many years ago. During the process of diagnosis, the differential diagnosis ruled out multiple sclerosis, optic neuritis, an elusive optic canal tumor, and so many other things, despite countless CT scans, MRIs, bolus dose, megadose steroids, being handed out a diagnosis after diagnosis, not realizing the kind of psychological repercussions they were having on me. The diagnosis of, definite confirmed diagnosis of glaucoma was reserved right to the very end, for which I had to fly to Singapore because I was expecting my youngest child and no one in Pakistan was willing to operate on a pregnant woman. At 8 months of pregnancy, I underwent a trabeculectomy without sedation with a retrobulbar block in my left eye in Singapore. My pressure came down, but I had lost vision irreversibly in that eye. Prior to that, I had been put on all 7 full spectrum of anti-glaucoma drops, keeping in mind their teratogenic potential. The laser had not worked, nothing seemed to have worked. But in the end, the trab worked, but it came a bit too late. After 5 years, my right eye followed suit. Again, the cycle was repeated. I was struck by panic. I began to lose sight in the only remaining eye in a matter of months. But the practitioners took a very laid-back approach, tinkering with glaucoma drops, opting for an Emmett valve rather than a trabeculectomy, which did not work. It failed. After that, I flew again to Singapore to save the light perception that I was holding on to for just a few more years. The trab was done, the pressure came down, but the trab scarred over despite the anti-scarring agents because the valve was already there, encouraging scarring. So by 2015, I was what is known as legally blind. My life as I knew it and I had known it for all those years, changed forever. I, on an emergency crash course basis, taught myself basic life skills. And once I studied myself physically, psychologically, emotionally, I embarked on a whole new journey, ready to embrace all the possibilities that lay ahead of me. I evolved into a writer, a painter, a trekker, a social activist, and recently, in September of last year, I trained to become a rock climber. How all this happened is because I valued the resilience of the human spirit far more than the limitations of my body. To you, as students who are going to be practicing medicine in the mainstream very soon, I want to emphasize the fact that study medicine as a whole and in its depth. Learn interpersonal skills when it comes to managing patients. Your patients are not just your case studies, they are human beings with stories to tell. Your decisions may influence their lives forever. When you reach a point with your patient where you can no longer help him or her medically, do keep in mind that you owe it to that patient to refer them to counseling and rehab services. Glaucoma requires a lot of research, and since I have started painting 12 months ago, it opens another avenue of research in terms of neuroplasticity, which I feel is intriguing and interesting. So if anyone wishes to contact me, Dr. Junaid Sethi has my contact details. Thank you.